Hello everybody, it's me, Rabbi Mahoney, here talking about Jewish medicine. So, I was diagnosed as having schizoaffective disorder, and for years they tried to prescribe me medications like Zyprexa, Abilify, Haldol, all of which gave me major allergic reactions that were identified as neuroleptic malignant syndrome. And whenever I'd go to the hospital, it would be bad because they would try to force me to take the medications, and I'd be like, nah, it's bad. I can't move, I can't sleep, I can't eat food. I have really bad headache. I have really bad, I feel really feverish, and it lasts for an entire day, and I can't eat food, I can't talk. It's it causes brain damage. Neuroleptic malignant syndrome causes permanent brain damage. So I can't take those medications. All my doctors, my psychiatrist doctors, have pretty much been very insensitive about the issue. Being that I have schizoaffective disorder, it makes me very uncomfortable that they're unable to really work with me unless I take the medications. One doctor though, Dr. Bruce Tanenbaum, was more sympathetic, and he talked to me, and we saw, I've been going to him for 5 years. I haven't gone to him recently, but yeah, he actually, and I told him that medical marijuana actually helps me. For some people with schizoaffective, it really messes them up, but for other people, it helps them a lot, and it helps me a lot. I don't feel the bad, mean, kind of angry voices. I don't. It's I can ignore that because my thoughts become so cloudy, but I can still think enough that I can function. It basically does what an antipsychotic would do, except without the side effect. And so my doctor, Bruce Tanenbaum, he told me, he recommended that, I do what I feel is the most healing thing for me. He said that he couldn't legally prescribe me medical marijuana, basically because the law in the state of Maryland says that doctors can't really do that, but he did recommend that I use it. So, that is that. And I've also seen, I saw, he's Jewish, right? And I'm Jewish. And so, it was I went on these journeys. Oh, dang it. Dang it. Oh, no, it's still going. Okay, so I went on these journeys, right? And, it was I saw him, or a guy who looked a lot like him, and I would be with these people, and he would be there. One time he was this computer wizard guy, and the other time he was just this guy, and it was interesting. I was wow, I really thought that it was him. I thought he was in disguise. That's kind of my delusions are sometimes, but I think it might just be Jewish culture. So right now I'm waiting for my insurance to come through, and everyone's trying to make me feel I'm someone with no education, who's an immigrant to this country, but that's not true. I think it just has to do with Jewish culture. So I wrote this recommendation at Tanenbaum's recommendation from the non-physical level, because we're a culture that operates not only from the physical body. When you hear about Israel, not everyone is going physically to Israel. That's not how it is. That's not how Judaism is. So it's we're just trying to have our culture live because it's better